Hello, you're welcome to Femcare Fertility Center. We are based here in Lubowa, and my name's Dr. Bahiz Emmanuel. I'm a consultant gynecologist specializing in fertility treatment. Today, I would want to talk about a condition that is very common in women called Polycystic Ovary Syndrome. In short form, it's called PCOS. It's one of the commonest causes of problems in reproductive health for women. We meet it a lot in our consultation rooms, and in the light of that I want to explain to people who would want to know more about it. It affects about 10-15% of women world over, though sometimes it's common in some parts of the world, like in Asian population, can be more. But at the same time, in places where there is high incidence of obesity, it has been proven to be increasingly identified as one of the commonest causes of this condition, PCOS. So it is very common that no single day when I sit in my consultation room that I don't get a patient with PCOS, especially those who are seeking services in relation to their menstrual disturbances, their infertility, their delayed to conceive. So it is high time the population get to know about this condition, and I will be encouraging more on how it presents and how it is treated. Polycystic Ovary Syndrome is a common disease that makes women consult gynecologists a lot in gynecological clinics. Even in this area of ours where we specialize in fertility treatment, we still find high cases of PCOS. PCOS is caused by various factors, but what has been agreed upon all over the world is a genetic predisposition. Studies have been shown that have been done and shown that women who have this condition actually their relatives, the mothers, their siblings, tend to have the same symptoms. And this has been found out to be due to various genes that affect their ovaries, and this is passed from a mother to a daughter or two siblings. And therefore, the genetic factor has been proven to be one of the most important ones. Another common cause of PCOS is associated with environmental factors, whereby people who have high levels of overweight, obesity, tend to develop features of PCOS. And according to international guidelines, PCOS is actually diagnosed in people when they are above 22 years, in most cases. So it's very hard to diagnose it when someone is below 22. And it has been proven that most people, even the young people who are below 25 years, when you present to a gynecologist with irregular periods, about 80% you find them they have a degree of polycystic ovarian disease. And because of the lifestyle changes, even in our country or even developing countries, PCOS is being diagnosed more often as a cause of what we commonly called hormonal imbalances. But it's just one cause. PCOS is one cause of the hormonal imbalances, but in most cases, when patients present in our gynecological clinics, we identify the main underlying problem as polycystic ovaries, which cause irregular menses. Someone can miss periods, can have heavy periods, and the common cause is because these people who have Polycystic Ovary Syndrome don't ovulate. Their eggs don't grow to the level where they will have an ovulation, and therefore they have what we call anovulatory cycles. And because of anovulatory cycles, they tend to have problems with their menstrual cycles, have less periods in a given period of time. They miss periods. someone can come to my consultation room and talks about 6 months without periods, and you find the cause as just being polycystic ovaries. Other causes of the factors that contribute to this is basically lifestyle, where people become inactive, and this one will eventually lead to obesity that will definitely contribute to this. As I continue to discuss about the problem of polycystic ovaries, one of the main advantage of PCOS that is treatable, especially when it is identified early. As the cause I've been discussing, it's being genetical, being associated with obesity, the main cause of these symptoms is because people who have PCOS have got what we call high levels of male hormones. They are females, but they have high levels of androgens. And because of these high levels of androgens, there is what we call insulin resistance within the ovaries. And the insulin resistance within ovaries, in relation to this increased male hormones, they will disturb the normal development of follicle, which is supposed to produce the female hormones that are supposed to be responsible for the normal cycle of the menstrual periods. And therefore, when we are treating, we target the cause. The cause has been this insulin resistance, so try to make sure that this person, if has obesity, we address the cause of obesity. Exercising, we encourage someone to exercise, we review their diet. We also tell them definitely to put on tablets which are used to reduce insulin resistance. And the commonest drug in the market is metformin, which is used to treat people with diabetes. So in the people who have PCOS, we use metformin for a period of 3 to 6 months to actually bring back the normal insulin usage in their cells, especially in the ovaries. Therefore, we target on 3 main factors: the lifestyle, the diet, and the medications. And this has proven that even if you put a patient who has PCOS and has obesity, you put them on diet, exercise, and medication, within a period of 3 months, their cycles become regular, and they can ovulate, and they can even conceive if the problem is conception. Another treatment modality is when this patient has symptoms like excessive hair on the body, which is due to this increased androgen levels, male hormones. We tend definitely to give them some medication and review their diet that it can come back to normal. We also have those who have failed to respond to our medications and the lifestyle changes. We do what we call ovarian drilling. Or those who are ovarian drilling is where you go and find that this ovary, which has become big because of multiple follicles that formed cysts, are not allowing the follicles to develop normally. Then we go and drill those follicles, and this will definitely improve on how the follicular development will occur in ovaries, and then they can develop a mature follicles and will be able to ovulate. And those who want to conceive will conceive, or those who have irregular periods, they become regular. And it's called, we use it laparoscopically by a condition called laparoscopic ovarian drilling. It is the last level where we treat PCOS, but in most cases, patients respond to the 3 previous interventions I've discussed earlier. So in case outside there, anyone has issue to do with irregular menstruation, they have excessive hair in the body, on the body, and they are ladies, they could be able to come and get services. At Fem Care, we are able to treat and help you to how to manage this chronic condition. Also, we address the long-term risk factors of this PCOS. Because of high levels of insulin resistance, the patients are at risk of developing diabetes in the future or hypertension. So we educate them on their lifestyle and diet so that they can prevent occurrence of these chronic diseases later in their lives. Thank you very much. See you at FemCare.